Hi, my name is Nina Robbins, and for my late breaking talk, I will be discussing experiences of Palestinian caregivers as they navigate cross-border healthcare access in Israel and the West Bank, as a presentation of master's thesis results and some supplemental discussion. The first section of this presentation will be an introduction and overview to the concept of therapeutic geography. Unlike the historic term medical tourism, which implies voluntary travel for healthcare, contemporary discussions of healthcare access across national borders comprise the process, components, and experiences of seeking healthcare in a foreign setting when domestic structures have failed. Based on fieldwork and historical reviews following post-war Iraq, physician and medical anthropologist Dr. Omar Dawachi and his colleagues in 2014 developed therapeutic geographies, exploring reorganizing healthcare systems across geographic and political borders due to conflict, as patients attempt to mitigate further biomedical and structural harm. Therapeutic geographies consider health settings deeply tied to physical places, while dynamically shaped by the individual and organizational actors and their structural allegiances that interact with healthcare delivery in these places. Dawachi and colleagues originally devised therapeutic geographies to account for the militarization of medical care and the exodus of health expertise that drove Iraqi and Syrian patients away from traditional domestic care systems while simultaneously valuing migrant patients with agency over their treatment plans as they craft chosen survival strategies. Dawachi's interlocutor, Dr. Max Skelton, demonstrates how kinship networks are crucial in helping families gather informational and financial resources to navigate health access against a backdrop of weakened familial financial standing and displacement through a series of ethnographic vignettes published in 2019. Max Skelton's angle provides an opening to considering the roles of caregivers in molding therapeutic geographies. Dr. Sarah Parkinson and Orkideh Behrouzan in 2015 were among the first to apply therapeutic geography toward Palestinian populations, describing health humanitarianism serving Syrian and Palestinian refugees in Lebanon. Conducting interviews with patients in a refugee camp and a hospital, they explore the roles of patients' socio-political situated knowledge in their clinical encounters far from home. Echoing literature on the biopolitical marginalization of Palestinians, Parkinson and Bekrzahn articulate that patient refugee status places healthcare interventions within, quote, broader experiences and practices of everyday refugee life, unquote, with all its stigmas and invalidations. While mapping the comprehensive landscape of healthcare accessibility and services across tumultuous settings of scarcity, Parkinson, Bekrzahn, and other social scientists have identified recurrent concerns of Palestinian refugees in Lebanon regarding their healthcare, namely concerns about affordability, ease of crossing military checkpoints, the sensitivity of care providers, and patient privacy. The question of discrete health concerns of Palestinians seeking care across borders has been studied on the borderlines of clinical and political inquiry. Public health research with Palestinians seeking care across borders in Israel and the West Bank in the past decade documents their concerns with the alleviation of discrimination present in their daily life, especially at the military checkpoints they pass to access healthcare across borders. The data for this thesis project were collected between June and August of 2023 to evaluate the Wheels of Hope initiative run by the Rosanna Health Diplomacy Organization. This initiative connects volunteer drivers and shuttles to transport Palestinian patients and caregivers to Israeli and West Bank hospitals. Integrated with community health partners, it serves a diverse group of Palestinian patients from the West Bank and Gaza who navigate complex therapeutic landscapes. The research focuses on a secondary analysis of interviews with caregivers from the West Bank or Gaza who traveled with patients. The study explores their experiences within Israeli and West Bank hospitals and their journeys to accessing quality treatment, structured initially as a phenomenological question that was modified toward a generalist critical anthropological analysis of the unique challenges these caregivers face. So, as is demonstrated on the table on the right part of the slide, there were 13 total caregiver participants in interviews, the majority of whom were female and directly the mothers of patients. About half of participants who were taking care of pediatric patients were from the West Bank, and the other half who were caretakers of adult dependents came from Gaza. The West Bank patients sought out care at a variety of hospitals in the 48 borders and in the West Bank and East Jerusalem charity hospitals, while the Gazan hospitals sought care at the An-Najah Teaching University Hospital near Nablus in the West Bank. The following section of this presentation will be a discussion of cross-border care-seeking challenges of Palestinian caregivers. The title of this section is derived from Mahmoud Darwish's poem, A Traveler. Given the brevity of this talk, I chose to share one very evocative quote from an El Khalil area mother, describing her experience advocating for herself at Israeli checkpoints on the way to bring her child to a pediatric oncology ward. She shared, "It was very difficult. We would submit the permit and it would be ready. We would go to the checkpoint and the officer would tell me, sometimes they wouldn't let me pass, but I would not turn back until they let me through. I used to put my documents on the floor and tell them I would not leave. I want to pass because I need to go to the hospital." Many of the themes from my coding thematic hierarchy can be recognized in that mother's short but very poignant statement. The following table is an extremely simplified summary of my results, and I welcome you to pause this talk recording to read them. The concerns expressed by caregivers in the study were closely tied to factors of uncertainty. They worried that unpredictable political obstacles could hinder access to essential medical care, such as government bureaus denying entry permits or checkpoint officers' arbitrary refusal to validate those permits. Infrastructural weaknesses in the occupied Palestinian territories determine the unpredictable availability of transportation services and acceptable quality health care in hospitals outside East Jerusalem and 48 borders. We remember that undermined health expertise through regionalization was a core part of Dawachi and colleagues' construction of therapeutic geographic concepts. When caregivers face uncertain outcomes while seeking health care across national borders, which is already a complicated and multifaceted process, they must exercise more financial risks to guarantee positive outcomes for their dependents. In turn, sentiments expressed by caregivers across settings were sensitive to the degree of streamlining and subsequent predictability in their cross border transportation. Caregiver impatience and anxiety were assuaged when cross border transportation's uncertain costs and logistical factors were alleviated. In one of their ethnographic vignettes, Parkinson and Bakrzan address concerns about uncertainty similar to those of the thesis. In particular, they highlight the uncertainties surrounding the diligence of medical providers in a Lebanese government hospital and the inconsistent coverage options available to Palestinians and other non citizen refugees seeking treatment from an expensive constellation of the Lebanese government and global humanitarian organizations. Are hurt by political barriers to access and resource scarcity precisely because they result from the subjugation of Palestinian health infrastructure. Bad faith bureaucracy and the obfuscation of access manufacture the logistical challenges that cause the most salient stress for caregivers. It is important to note, key to Rosanna's organizational mission, that caregivers expressed genuine gratitude toward volunteer organizational actors, and that positive encounters with volunteer coordinators and individual drivers improved their care seeking experiences. To revisit uncertainty, caregivers enjoyed the stability of volunteer transport services and were enriched by relationships they formed at Israeli hospitals through increased familiarity. Nevertheless, positive caregiver attitudes about volunteer transport services centered foremost on ease of access, where Palestinian caregivers seek high quality healthcare during ongoing political crises by any means necessary. Dr. Yara Asi's 2022 article on the Israeli de-development of Palestinian health systems provides thorough health historical documentation to argue that Palestinian healthcare should operate independently, forced entirely outside suppressive systems. Moreover, I want to touch on political deprivation, a validated construct developed by Hamoudet and colleagues in 2022. By identifying political deprivation as a specific cause of human insecurity, they highlight that deprivation includes material conditions, political contexts, and freedoms. Their research establishes a correlation between increased political deprivation and heightened mental distress. Additionally, acute exposures to political violence, especially after Gaza in 2014, intensified this relationship, underscoring the compounded effects of vulnerabilities like poverty. We can interpret from Hamoudet and colleagues that the hardships experienced by Palestinians while seeking vital health care cut deep across many intersections of scarcity and violence, and that goodwill between caregivers, their families, and volunteers is simply not adequate. Please pause this presentation to read a quote by Botticelli from 2018 that was included in a Kemp article in 2020 about goodwill during occupation. The checkpoint severing Jerusalem from Ramallah, Hollandia, and its near Bethlehem counterpart, best known as Checkpoint 300, are recurrent nightmares for Palestinians traveling in and out of the West Bank to seek care. Over several years in the 2000s, Dr. Helga Tawil Souri collected insightful and extensive ethnography at the Kalandia checkpoint. As Dr. Tawil Souri contextualizes at length, a significant contributor to the centrality of political dependency in caregiver experiences of cross-border healthcare is the role of military checkpoints as a nexus of transport services and Israeli state control over Palestinian access, she writes in 2011. Thematic analysis in the study demonstrated that checkpoints were the preeminent cross-border health setting for caregivers, quantified by topic frequency and a high correlation between checkpoints and other settings. This analysis finding was unsurprising, as every component of this modified phenomenological inquiry, from collection sites to the content of responses, centered checkpoints as critical spaces for determining and causing adverse health outcomes. The final section of this presentation is aptly titled Gaza and Praxis. As of writing, over 42,334 civilians have been reported killed in Gaza by Israeli bombardments over the past year, with over 99,000 reported injured. Only 17 out of Gaza's 36 hospitals are even partially functional, and there is a dire shortage of essential medical supplies, with none of the 25 primary healthcare centers in North Gaza functional. Gazan epidemiologists estimate that 640,000 cases of acute respiratory infections and over 340,000 cases of diarrhea persist, with malnutrition affecting tens of thousands of children amid catastrophic humanitarian conditions. Multifactorial harm wrought by regional violence will force Palestinians and their dependents to increase cross-border travel to access adequate health care, as we already see in the mass movement of families looking to reach Western Europe, the United States, and Canada for healthcare through Egypt. Increased obstacles to free movement now and through the political reshaping of Gaza will exacerbate all adverse emotional and healthcare outcomes documented in the original data collection. In her 2015 essay in Public Culture, Dr. Alana Feldman recognizes that humanitarian interventions for Palestinians, like the Wheels of Hope initiative, may legitimately alleviate economic and bureaucratic barriers in the short term and empower care seekers with some agency in health seeking behaviors under extreme political duress. Where humanitarian contributions grind to a halt, though, is in actuating, quote, people's continuing desire to have their lives accorded not only value, but also equal value, with the reality of circumstances that seem to ensure that this will never be so, end quote. Feldman's point about equal value led me to introduce Darwish's A Traveler poem, discussing the control Palestinians justly demand over uncertain and discriminatory conditions. Because people participating in therapeutic geography must endure such complexity in accessing crucial vital care, they develop intense familiarity and creativity in pursuing treatment options, as discussed by Duwachi and colleagues in 2018 and by Parkinson and Behrouzan. Feel free to pause this recording to read a quote by Bell Hooks, included in Kemp's 2020 article about the knowledge of colonized people. This paper documents the unique experiences of Palestinian caregivers to thread theory and practice for dynamic health systems interventions, but more importantly, to bear witness to Palestinian struggles under apartheid. Over a year into the escalation of Israel's systematic obliteration of Palestinian health, we must critically evaluate the role of volunteer transport services. Gazans cannot even leave the Strip to guarantee their immediate survival, and when people are dying from Israel's bombs, starvation campaigns, and communicable diseases far faster than from the chronic ailments they sought cross border treatment for in the first place. Kemp problematizes privileging Israeli health humanitarian actors as, quote, benefactors for Palestinian health, and cites Dr. Rita Giacoman on this point. The logic is incomprehensible. The Israeli army destroys the health system in the occupied Palestinian territory, and it bombs, shells, and shoots Palestinian civilians. Yet, instead of calling for the end of onslaughts on civilians and the end of Israeli occupation and colonization of Palestinian land, Israeli medical professionals call for collaboration to advance Palestinian health. Not only does this not make sense at all, it is insulting. This is from 2018. Israeli health diplomacy initiatives need to seriously challenge how they can support meaningful triage services while listening to Palestinian demands, uplifting their expertise, and decolonizing health systems. To the extent that Palestinians engage with Israeli systems to access immediate care, we must center their lived experiences, indeed their mastery, to spur immediate change. As an early public health and anthropology professional, I wanted to acknowledge the many individuals who helped me develop the necessary grounding and theory and practice and political knowledge to be able to create and deliver this presentation. Please pause the recording to read all of the names, but I especially wanted to acknowledge the thoughtful, generous, and unimaginably strong Palestinians who offered me their time, stories, and sometimes invitations to their homes during my data collection. Indeed, I dedicate my thesis project to the indelible spirit of the Palestinian people and call for peace for all between the river and the sea swiftly in our days. Finally, this is a bibliography of the sources that I referenced in this talk. It is a very non-exhaustive list of all of the sources that I used to craft my thesis and analysis. Thank you all so much for listening to this presentation.